In the front row and work your way back. So if you wouldn't mind moving up to the front, fill it up, and then move back, because that was his request. He's speaking. So I'm going to ask you to do that for him.
Thank you.
Everybody move.
That way I don't have to yell, you know.
And since it's 2 o'clock and I like to start on time, I'm going to start. So this is probably the easiest segue that Garrett Harding's ever going to have on this type of talk, because first of all, I didn't think I was going to live to be 40, and once I reached that, then everything's been gravy years from here on out. So there's many reasons I didn't think I'd reach 40, but I did start my first cancer screening at 40. My father died of colon cancer, adenocarcinoma, at 69. My mother died of cholangiocarcinoma at 70. And my uncle died of adenocarcinoma, colon cancer. My grandfather died of colon cancer at 58. And if that wasn't enough, my wife was just diagnosed with breast cancer in October, from a routine mammogram that she gets every year. So it's an easy segue.
So you're saying you're bad luck? You're bad luck?
If there wasn't bad luck,
He's still alive. He's got good luck.
Right?
No, but everybody you know around you, so please.
Everybody I touch, come over here. So, anyway, I guess I've done 5 colonoscopies since I was 41, every 5 years, and I tell you, the procedure's nothing to it. It's the day before leading up to it that it's not so pleasant if any of you ever have to go through that. But my wife said on the way home every time that was our best conversations we ever had on each of those 5 drives home from that, because I don't remember a thing I said, and she ended up getting something new every time. Anyway, having said that, Garrett Harding's got his bachelor's, popcorn, a Bachelor of Science in the Community Outreach Manager of the Community Outreach and Preventive Education Program at Huntsman Cancer Institute. 140-mile bike ride coming up. Everybody sign up for it, get your pledges in, and we'll ride together. I rode it last year. It's awesome. It's only 140 miles, so easy bike ride. His program assesses the need for, implements, and evaluates cancer prevention education efforts using evidence-based practices. Mr. Harding works in collaboration with internal clinic and research programs and external community partners to address health equity in targeted populations and reduce the burden of cancer in Utah. His program educates approximately 85,000 individuals per year in English and Spanish across ACI's patient catchment area, with projects ranging from radon awareness, tobacco cessation interventions, cancer screening, sun safety, and lifestyle factors related to primary prevention and cancer risk. He is a trained patient navigator, certified tobacco cessation facilitator, and is fluent in Espanol. In addition to his role at ACI, he serves as the Utah Tobacco Free Alliance Vice Chair on the Utah Cancer Action Network Executive Committee, and is an active member of the Utah Public Health Association, Utah Worksite Wellness Council, the Society for Public Health Education, and the Cancer Patient Education Network. Wow. Mr. Harding is passionate about community-based education, kind of what we're doing here today, social marketing, and policy interventions that promote behavior change. Outside of work, he reads, writes, travels, plays golf, and tennis. That would be you. So,
that's me. Thank you.
Without any further ado.
Thank you so much. Great. So those in the back, if you want to move forward, that'd be great, just so we can have a discussion. Even if you have to leave early, it'd be great if we could have everyone just move forward. Only that way I don't have to yell. So, wonderful. So thank you for the introduction, and then thank you for hosting me today. This is a great opportunity. I think we have a great group. And like I said, I hope that we can actually have a discussion about cancer prevention, because I think all of us in the room have been affected by cancer in more than one way. Is that a fair assessment? Okay, so whether that's someone you know that's passed away from the disease, or maybe you yourself have a personal experience with cancer, we won't get into those today, but I think it's really great to note that all of us, in one way or another, are affected by the disease. So who has heard of Huntsman Cancer Institute before? Okay, So we're very well known in the community. Part of the reason is because we have a mission that is fourfold in terms of research, so understanding cancer from its beginnings, using that knowledge to improve and create cancer treatments, so the clinical side of actually treating patients, as well as relieving the suffering of cancer patients and then providing education, which that fourth bullet point is what my program is very much specialized in, and really educating the population about what we can do to lower our cancer risk. Because we hear it all the time, well, it doesn't matter what I do, I'm going to get cancer. How many people have heard that before? Right. Well, I'm here to tell you there are certain things that we can do to help lower our cancer risk, and you've probably heard them in the past, but we're going to explain about how they actually are related to this disease, which is actually more than 200 different types of disease lumped into one. So we are located on the University of Utah campus. So this is just kind of an aerial view, but like I said, right here, phase 1, we broke ground, dedicated in 1999 as a research facility. This is the hospital over here that has been expanded since 2004. We treat all types of cancer. Our patient catchment area is not only Utah, but the entire Intermountain West, which is composed of basically the Dakotas, Idaho, Nevada, Utah, Wyoming, parts of Colorado. And then on June 21st, we're actually dedicating this phase 4, which is going to double the size of our research space. So you can see kind of cancer is an epidemic, and so it's very important that we actually understand what's happening and taking what we learn in our labs and in our clinical research and actually put it into the hospital so that we can better improve those treatments that are there. I just wanted to note that we work with a whole bunch of community partners. So on any given day, we're out in the community, my staff and our team really educating and partnering. We work really closely with the Department of Health at a state level, as well as the local level, and then throughout the entire state. So I just did want to, before we talk about cancer prevention, I think we really need to understand what cancer is, right? So who can give me a very basic definition of what cancer is?
There's cells that go out of control, that grow rapidly and kind of mutate into their own self into tumor-like lesions. I guess that's pretty simple.
It's a great definition, right? Did you want to add anything?
That's pretty much.
Okay, pretty much on point. What else?
They're cells that are abnormally destroyed by our own immune system that they hide. And so our immune system either doesn't recognize them or it can't find them.
Okay, great supplemental answer to that one in terms of just all of our bodies are made up of cells. Cancer can occur in any of these cells, right? So usually the cancer that is most associated with that cell, that's where the cancer gets its name, right? So if there's cancer that happens in the skin cells, well, it's going to be skin cancer, right? Same idea with the lungs, the breast, any of the other tissue in the body. So very basic elementary definition, we like to say it's when our cells, they have a normal functionality. When those cells actually stop doing that and they start behaving badly or they grow abnormally, then they start, dividing with those properties that actually are abnormal. So when someone passes away from a disease, it's not because there's just one cancer cell in their body that has grown. It's because those cancer cells have grown to form a tumor or a mass, or they've entered the blood system and they've spread to other parts of the body, or they've overtaken the actual organ or the organ system and caused that actually organ to fail, and so those cells aren't able to do their job. So that's kind of at least a little bit about kind of the biology of the genetics of cancer. But we do have 2 slides here just so that you can see what a normal and a cancerous cell looks like under a microscope. What do we see are the differences, at least visually, right? I know you're not pathologists, but...
Lots of nuclei out of control.
Okay. So lots of nuclei out of control over here. What else?
Disorganized.
Disorganized, right? So anyone want to guess what type of cell this is? What did you say? Okay, well, that's very technical. But this is actually, it's just coming from the colon area of the body, so the large intestine. But you can see, even in terms of color as well as organization, that there's a functionality to the cells of our body. And when it's a cancerous cell, you can see, at least pathologically, that, well, there's something wrong there, right? In terms of disorganization, the cells aren't able to actually perform the function that they have. So this is just showing 7 areas of the body, so an anatomical and a skeletal view. But I just want to pose here, so let's say someone gets diagnosed with colon cancer, which is part of their large intestine here, and then that cancer grows undetected, and then it spreads to the lung. What type of cancer do they now have?
Metastatic.
Okay, metastatic. What does metastatic mean?
Spread throughout.
So it's spread, right? So the reason I pose this question is not necessarily to make it seem like all cancer spreads, but really to show that wherever the cancer starts, those cells actually migrate to other origins in the body. So the lung cells that are actually doing its function, for the most part, they're going to actually be really great and really healthy. But now they've been invaded by colorectal cancer cells that are now growing on the lung tissue. So they're almost invading certain parts of the body. So it comes down to the treatment that really we're going to treat this cancer, even though it's in the lung, we're going to treat it as if it's colorectal cancer, right? Another reason to really understand that is colorectal cancer is very hereditary. And so if you go into the doctor and you say, well, my family member passed away from lung cancer, I'm really worried about what my personal risk is. But maybe that person doesn't understand that it really is colorectal cancer that has spread to the lung. Does that make sense? So it's really important to identify what your family history is, to know if someone has passed away from a metastatic disease, where the origin was and where it started, because there are certain genetic factors that you have to be screened earlier for if you have that type of cancer in your body. So what is a woman's lifetime probability of developing cancer? 1 in how many women will develop the disease? What do we think?
3.
Okay, I heard 1 in 3, 1 in 5. What else? It's kind of high. Does anyone think that maybe it's less, or maybe it's more? Okay, it actually is 1 in 3. So we are correct. So this is an incidence rate. So it's just showing, about 30% of women will develop cancer across their life. Breast cancer is the most common type of cancer in women. About 1 in 8 women will develop that type of cancer. What do we think it is for the men? Do we think it's higher, or do we think it's lower?
For prostate, I know it's 1 in 4.
Okay, so prostate, 1 in 4. It's around 1 in 5, 1 in 6, more or less, for prostate cancer. It's actually higher, right? So 1 in 2 men will develop cancer in their lifetime. This is because the rates of skin cancer, the rates of prostate cancer, other things that have been shown, to increase our risk. So these numbers are very staggering. So that's when I say all of us will be affected by the disease at some point. It's going to either be ourselves, or it's going to be one of our loved ones or family members or friends. So what we really work to do is to educate people on how we can actually lower these rates so that less people are developing the disease based on their lifestyle behaviors. So this is the most recent data we have from the Department of Health, but this just shows the cancer numbers in the state. The dark blue line is the number of new cases, and the lighter blue line is the number of deaths. So you can see with prostate cancer in the state, there's a lot of new cases, but a lot of men may live with prostate cancer for several decades without ever receiving treatment, with a very low death rate. Same with breast cancer in terms of just the proportions of new cases to deaths. But things like lung cancer that you can see here, pancreatic cancer, you can see that these have higher death rates. It comes down to the screening mechanisms that are available, right? So lung cancer, for the most part, doesn't show a lot of symptoms until it's stage 4, stage 3, and so that person may not have a longer lifespan. And so we really just want to focus on these top ones here, because all of them have screenings available that we're going to talk about today. And the reason they have higher number of new cases is also because we're screening people, right? The more people we screen, the more cancer we're going to find. So a risk factor is anything that is increasing our risk of developing the disease. These are the 10 most common risk factors for cancer. They are in order. So you can see that aging in and of itself, just by aging, is increasing our risk. What else on here is something that we cannot change? So we can't change our age. Family history, right? So those two things are things that we don't have control over. No matter how hard we try, we can't really reverse the aging, and we can't really change what our genetic makeup is with our family history. However, all of these other things we do have control over to some extent, right? Is anyone surprised to see anything that's on this list? Right? We know a lot of these things, like tobacco. How many times have we been told that tobacco use is harmful, right? That it's the number one cause of preventable disease and death in the United States and in the world. But we're just going to go through a little bit of this. But I did just want to point out that only 5 to 10% of cancers are actually hereditary, meaning passed down from one family member to another. So that means that 90% to 95% of cancers, what is causing them? Well, it's everything that was on that last slide. So tobacco use causes about 33% of all cancers. That's not just lung cancer, but dozens. Obesity, overweight, that number is actually increased to almost about 30% as well. HPV, hepatitis B, things that are infectious, diet, physical, and activity. So my main message that we wanted to get across today, kind of going forward, is that 50% of these cancers can be prevented if we engage in 5 behaviors. So what do we think are those behaviors? What's on that list? Okay, so I heard diet and exercise. What else? Okay, avoiding tobacco.
Wear sunscreen.
Okay, wearing sunscreen, being sun safe. Did we say exercise, diet and exercise together? Then the other one, cancer screenings, right? So we're just going to go through each of them and dive a little bit more before we finish. So does everyone recognize the tobacco products that are on the screen? Okay, I heard a no. So which ones don't you recognize?
I guess vaping is...
Okay, vaping. So we have chewless tobacco here. We have a cigarette, obviously. We have this vaporizer. What do we know about e-cigarettes?
They're full of nicotine, so they're pretty addictive.
Okay, so he said they're full of nicotine, so they are addictive. That is correct. What else?
It's a really good delivery system to get it through your bloodstream.
Okay, so it's a delivery system for that nicotine and maybe other harmful chemicals. What else do we know? Or what don't we know?
The car next to you, when you see a kid vaping or whatever, it's all full of smoke. Surprised they can see out of the vehicle.
Okay, so you see a lot of kind of the effects of the vape, right? Either in the smoke or the vape that is actually coming from the device.
I guess
What
since it's
else?
so underregulated, FDA probably hasn't done, well, they have, but they haven't done a whole lot to prevent what is in the solutions that they use that could be carcinogenic. So I don't know how much FDA has studied it.
Okay, so there's a lack of research, right? They are unregulated to some extent. Luckily, in the state of Utah, with the Indoor Clean Air Act, they fall into that category, so you can't actually use them inside, and you have to be 25 feet away from the building, which is great because most states, I think there's only 3 other states that have that same law. And so, sure. So the biggest thing to remember with e-cigarettes is they are under-researched, okay? Salt Lake County did a study about 1.5 years ago, and they went and they looked at all of the different nicotine cartridges. So the way that this works is there's actually a battery here. There's a nicotine cartridge, which contains a lot of different flavorings as well as the nicotine itself. And then there's a combustion that when you actually heat this up and you inhale, that's what causes kind of the reaction so that you can inhale that specific nicotine into the lungs. Well, what they found is everything that was actually labeled on those ingredients was completely off because they're currently unregulated. And so there was discrepancies in the amount of nicotine, there was discrepancies in the amount of carcinogenics that were actually inside the nicotine substance itself. And so what we like to say is they're not a healthy alternative to cigarettes. A lot of people like to use them and claim that they're a cessation device to help them wean themselves off of tobacco. But there's been no research that shows that that is actually effective. And then also anything you inhale into your body, whether it be tobacco, via cigarettes, hookah, marijuana.
Today's air.
Right, today's air. All of those things can be harmful to your lungs, right? And so we don't want to inhale anything into our body that doesn't need to be. However, we do recognize that there are people, I mean, even though Utah has the lowest tobacco smoking rates in the country, we're at 9.8% as of last year. The national average is double that. There's great resources through the Utah Tobacco Quit line where you can call. They'll actually pay for the NRT therapy, the patch, the lozenge, the gum for free if you enroll into their program. So there's a lot of really great services through the state here. So yeah.
Obviously, we're not big smokers. What's our incidence of smokeless tobacco? We have a lot of cowboys that do a lot of shooting.
Yeah, I don't know the specific number, but I do know that it is still relatively low. But that's based on a number of things, like the culture here. There's a lot of individuals who, based off their religion and their culture, just automatically don't use any of those things, as well as kind of the active outdoor lifestyle that we have as a state. But we can look into the numbers, and I'm happy to give you those afterward through the report. So does anyone know what the average cost of a pack of cigarettes in the state is? Okay, I heard a few things. $7, or you said $4. I heard $7. So it's around $6. So we use this a lot kind of with the teenagers and those who may not have a lot of money. Because if you're smoking a pack a day, I mean, it's almost $200 a month, up to over $2,000 a year. So depending on your income, your socioeconomic status, that may be a lot of money in terms of actually starting. And then obviously the more you smoke, the more you're going to actually pay. So moving on. Number 2, exercise more. So how much exercise is enough? I know that you guys have probably sat through a lot of these wellness discussions that talk about exercise, talk about healthy eating, but what is enough to actually prevent cancer, prevent cardiovascular disease?
There is no limit. It's what your mind tells your body to do.
Okay, so there's no limit. That's a great way to think, but there are specific guidelines. So I heard a few things. What did we say in the back? At least 30 minutes per day. So it's actually even 5 or more days a week. So that's not even all 7 days. It's 30 minutes a day, 5 or more days a week. But then, if our fitness improves, we want to shoot for 60 minutes, right, of that vigorous physical activity daily. So these are recommended through the CDC, through the other, health agencies here. But I want to touch base on the limiting the sedentary activities. There's been a lot of research that's actually come out that says that even if you stand for 5 minutes every hour, that can extend your life later on. So it's not even necessarily getting up to this vigorous physical activity daily, but it's actually getting up every single hour if you are at a desk job, right? Getting up and moving, or getting a standing desk, or even, taking those breaks throughout the day. A lot of those things are going to be beneficial throughout the long term. The other thing is we really want to limit these activities because, like for myself, if I'm not at my desk, and if I did have children, I would know that they probably would be very engaged in, say, like tablets or phones or video games or computers or all of those things. So you think about it, it's no longer just ourselves, but it's our family members that are also engaging in these type of like sedentary activities, checking, Twitter to see what the president has said for the day, or, really engaging in these activities when we should really be out there encouraging our family and friends. So, what are some ways to get exercise? Because I know a lot of people like to just think, well, I need to go to the gym, right? Like I need to have a gym membership, or I need to do a 140-mile bike ride.
Let's do that this year.
But we're almost at the extreme. So if people aren't really engaged in an activity every day, we're not just going to be able to get on a bike and ride 140 miles, right? And so we have to train our bodies in that succession so that we can actually start with 10 minutes, 15 minutes, 30 minutes, and go from there. So keeping a healthy weight. So what is a healthy weight? Right? So you can look at this and we can say, well, the culture, right, is telling us that this person is overweight. And this person, maybe looks underweight because they're more scrawny and they may not have as much muscle mass. But who is to say if someone is healthy? Because being overweight does not necessarily equate to being unhealthy, and being underweight doesn't necessarily mean that you are healthy, right? So who defines what a healthy weight is?
The guy does your BMI.
Okay, so we've heard of things like the BMI. We do have the BMI chart, which is the body mass index. And if you guys aren't familiar with the scale, you take your inches in height here, and then the pounds that you have in terms of your body weight, and then you can fall into certain categories. Well, this is not the best predictor of a healthy weight because really it's more just a little bit of your genetics to say, well, maybe I fall into this overweight category, but I may not look overweight. So who should we be discussing our health with?
Our family physician.
Your doctor, right? Your healthcare provider. But who do we talk to our weight about? Usually. Everybody, right? On social media, we talk to our friends, we talk to our coworkers, we follow blogs that we don't necessarily know if they have the credentials to be able to tell us what we should be eating. Maybe we fall victim to some of these multi-level marketing schemes where we think, I really need to take 25 vitamins a day to help get me to this, this weight that I may never achieve, right? So we talk about all of these things to everyone except our doctor. So I think we can do a better job, hopefully today, of at least explaining that we should have these conversations with the proper people who have gone to school, and actually they can help us achieve whether we want to increase muscle mass, whether we want to decrease our body weight, or we want to just kind of stay where we are. So we're just going to go through some specific slides here. These are from the CDC, but they just show what the obesity trends are basically from 1985 up to present day. So I'm going to go through them pretty fast, but you can see the key over here in terms of the light blue is 10% or less of the population that is overweight and obese. And obese is 30 pounds or more overweight, okay? And then 10 to 14%, and then you can kind of just see as we gradually move into the 90s, we can see that we've added like the dark blue category, right? Then as we move forward to the end of the 90s, we can see that they've actually added another category, which is, 20% of that population in that state is overweight or obese. So look at Utah. Maybe if you're from another state, you can kind of see what the other states are doing as well. So as we get into 2001, we've added another category here with orange. As we move forward, 2005, a darker red category. Up through 2010, which is kind of where this slide ends, but you can just see the state of, health of the nation has drastically changed in 30 years, right? 30, 35 years. So in the amount of time that I've been alive, we have actually gone from the majority of the population being, fairly healthy in terms of weight to at least, a fifth, a fourth, sometimes even a third, depending on the state that you live in, of the population. So what's contributing to this?
Krispy Kreme donuts.
Okay, Krispy Kreme donuts, right? So,
180 channels.
okay, so let's classify those. So we can say, okay, maybe the convenience of fast food, right? You said channel, so television. The amount of just TV that is offered that we feel like we have to consume all of that. What else?
Virtual exercise.
Yeah.
Oh, video games.
Okay, so we said video games. Did everyone hear what she said? Do you want to repeat it?
Busy lifestyle.
Busy lifestyles, right? So we've added more to our plates, right? It's no longer just, I'm going to work, but I'm going to work and I'm going to also engage in this volunteer activity and I'm going to do this responsibility and I'm going to take my kids to 5 different practices throughout the week. Yeah.
Well, that just goes along with the stress level today as compared to when I was a boy is astronomical.
Okay.
We're just married to these stupid cell phones. Everybody, we're always, they can never have a time where you're just out.
Right. Where you're just kind of enjoying, right? Just being present. So all of these things contribute, but let's think of TV, for example, or even the fast food industry. Are they forcing us to engage in the television, right? Are they forcing us to actually buy those unhealthy options at the grocery store, that are filled with preservatives, or even, the fast food industry? So it's a lot of contributions, but I think it's really interesting to note that a lot of this can be prevented, right? I mean, it does take a complete culture change of how we view not only ourselves and our life, but also kind of the state of the nation to be able to say, well, why don't we install wellness programs and implement wellness programs into the work site? If everyone's working way more than they used to be working, then why aren't we really putting a focus on these wellness programs, maybe that are part of the corporation or the organization where you work? Or what can we do to actually market healthier options in the fast food industry, right? If we're going to go there for the convenience, well, what are the options that are going to be the healthiest that are not the ones that are full of 2,400 calories for that specific meal? So just some things to keep in mind, but all of this is just contributing to the stress, to the anxiety, to not only cancer rates, but diabetes, as well as the cardiovascular, all of these other things. So this was some research that was done out of the University of Utah, kind of just looking at how much sugar we drink. You guys are obviously very involved with the agriculture industry here, but we found, just 20-ounce culprits in terms of how much sugar is in those options, because we like to say, well, maybe I'll get a tea instead of a soda. Well, if it's a sweet tea, you can see that the amount of tablespoons of sugar is almost very much equivalent to what's in the soda, the fruit punch. Drinking one 12-ounce can of soda daily can increase, your weight 15 pounds in 1 year. So if anyone's looking to lose weight, that's one of the easiest ways to actually lose weight, is to stop the soda intake, as well as the sugary beverages that's accounting for that. Has everyone seen this? Okay, so I'm assuming most in this room are probably very familiar with the new guidelines through MyPlate. I think this is genius just in terms of really teaching it in the schools, because we do a lot of different populations from kindergarten all the way up to senior centers. And we can say we eat on plates, right? So it's very much easier to understand that when I sit down, half of my plate should be fruits and vegetables every time I eat, right? We don't have to worry about what this pyramid looks like, what the different suggestions and serving sizes are, but really just focus on half of our food should be fruits and vegetables every single day to really maintain that healthy weight here. Has anyone heard of any foods that fight cancer? Okay, so there's some research that's out of the American Institute of Cancer Research that shows that if we incorporate these specific foods into our diet combined with exercise, then they have the power to actually reduce our cancer risk overall. So all of us have probably eaten a lot of these things on the screen, but it really just goes to show we have a partnership with Harmon's Grocery Store that we actually have shopping lists in all of their 19 locations across the state, where we actually promote these types of foods. So you can see they're actually whole grain foods, fruits and vegetables, healthy proteins that aren't mammal protein, that actually help increase the cancer fighting potential within your body. So just going on, there's only 2 things left and we'll just wrap it up. But getting cancer screenings. So who has heard of conflicting messaging surrounding cancer screenings? When we should get a cancer screening versus when we shouldn't, the age that is appropriate maybe for a woman to get a mammogram compared to maybe what should a man be getting in terms of the cancer screenings. Has anyone heard any of that controversy? Sounds like almost every day on the news there's something else coming out that's saying, well, don't do this, don't do this, do this, depending on your age. So I'm just going to go through the 6 main cancer screenings that are available and talk about what we recommend through Huntsman Cancer Institute for this community. So breast screening. What is the breast cancer screening? Mammogram, right? What's the other one? Has anyone heard of a clinical breast exam? All right, so every woman between the ages of 20 to 39 should be getting a clinical breast exam by their healthcare provider. That's when the physician is actually just feeling the tissue around the breast to determine if there's any lumps. So before the age of 40, every woman should be doing that along with their Pap test when they go in for their gynecologic exam every 2 to 3 years. Then starting at the age of 40, You do that breast exam every year, but then you also add the mammogram. Mammogram is a fancy word for x-ray, all right? It's really just where they will take an x-ray machine and take a picture of the breast. At Huntsman, we actually do same-day results, so you can get the results back that same day, right there, the reading from the radiologist, so that it reduces the anxiety level that you have to say, well, the doctor will be calling you next week, and you have to worry kind of for that whole week if your mammogram is going to be normal or not. So this is where there's been a little bit of controversy, but the evidence through the journals and the published articles really show that starting at the age of 40, women should be getting a mammogram every single year. It's covered by insurance, 100% preventative care. So if you have insurance, that's what should be happening. Cervical cancer. What's the screening for cervical cancer for women? Pap test, right? So women aged 20 to 39 should be getting that Pap test along with their clinical breast exam every 3 years. Has anyone heard of the Pap test and the HPV co-test? Okay, women, I would highly, highly recommend that you discuss with your physician and your gynecologist to get the Pap test and HPV co-test. The reason why is human papillomavirus, HPV, is the #1 leading cause of cervical cancer. So 95% of cervical cancers are caused by the HPV virus. And so if you do this co-test, it's even more accurate because it's looking for the virus inside your body. If you do that, you can get away with that test every 5 years because it's so accurate. If not, you can continue the Pap test every 3 years. If your gynecologist is not doing this HPV co-test, then they're definitely behind with the research that is out there in terms of clinical best practices because this co-test has been shown to be way more effective. Yes?
I had a question about that. If you take one of those tests and it's negative, can you then get the vaccine that's available now?
We're going to talk about the vaccine. That's a great question. Yeah, because there's certain age categories where you can actually get the vaccine, depending if it'll work. So what is the cancer screening for colorectal cancer? Colonoscopy, right? When should we start getting colonoscopy for men and women? Age 50, right? So age 50 and up, getting a colonoscopy every 10 years. If you have someone in your family history, direct line that has colon cancer, you may start way earlier than the age of 50. Let's say they were diagnosed at 45 and they had colorectal cancer. You may get a colonoscopy at the age of 35, even 10 years prior, because it is so hereditary in nature. So this is conversations that you need to have with your physician if you are high risk. The other thing I want to know is colonoscopy gets a really bad rep because they like to say that prep is so bad. And I don't want to miss a day of work. I don't want to have to do the prep the night before and actually go in, and it's very invasive, right? It can be embarrassing in a lot of cultures to actually have the colonoscope go to an area where no one ever goes, right? In terms of kind of in our colorectal area. But my message today is that if you are an average healthy person, you only need 3 colonoscopies in your lifetime, all right? You think about skin cancer screening every year. You think about a mammogram every year. Colonoscopy, it's literally 3 times in your life. It's also covered 100% by insurance. And so, not really any reasons. Any questions about this? Okay, prostate exam. Do all the men in the room know what the prostate exam is for cancer screening?
I had one today.
Okay. All right. So the thing that I will say about prostate cancer screening is in the last few years, they have not been recommending it for all men across the board. All right? Because it is not the most effective in actually detecting prostate cancer earlier. And if you remember the chart that I showed you from the beginning, there's lots of new cases of prostate cancer, and the men may live with prostate cancer for many decades because it is so slow growing. There are aggressive types, but they are less common. And so this is really a conversation that you should have with your doctor to really say, should I be getting this exam every year? Should I be getting it every 5 years? Or do I not need it, if I'm 75 years old and I no longer, need to have this prostate exam? What's the cancer screening for skin cancer? Has anyone had a skin cancer exam or ever heard of it? Okay, it could be a biopsy for diagnosis. Yeah.
Do a total mole exam.
Total mole exam, look all over your body. So we like to call that a skin exam, just basic skin exam by the physician. But Utah has the highest melanoma rates in the country, the highest skin cancer rates across the board. We're going to end talking a little bit about why that is. But I think it's very important that everyone age 18 and up, so all of us in the room, should be doing a skin exam of our own skin, a self-exam, every single month. All right, that may sound like a lot of work, but then we can go in and see a dermatologist and they look over our entire body, right? They look at our scalp, they look on our bottoms of our feet, they look everywhere because skin cancer can happen on any of the skin, and skin covers our entire body, right? Last one we'll talk about here is lung cancer screening. Has anyone heard of the lung cancer screening? It's fairly new. I would say within the past 5 years, it has been approved by all the national organizations, but it's for high-risk individuals. So if you know anyone 55 and above that has actually smoked 30 pack years, so that's a pack a day for 30 years, or 2 packs a day for 20 years, or 3 packs a day for 10 years, then they would qualify for this CT scan. This was so effective in the clinical trial that they actually ethically ended early because it was showing such promise. So this has the potential to save innumerable amounts of lives, but the problem is the people who need to know about the screening don't know about it. So if you guys know anyone that are smokers in your life who have been recent smokers that fall into this category, this is also covered by insurance, right? So that's how all the preventative screenings work. And so you just make an appointment, with radiology at any of the large facilities here in the state that offer this, and that's a great life-saving tool. So just to end, we're going to end on sun safety. So I mentioned that Utah has the highest skin cancer rates in the country. A lot of it has to do with our outdoor lifestyle here, right? So our elevation, because we are so much higher in elevation, we are closer to the sun. I mean, it's pretty basic to say, well, we're closer to the sun. And so if you were to go to Deer Valley or Snowbird, the very top of those ski lifts, we've done some work with the ski resorts and we've seen that they have even higher rates of skin cancer, those employees that are working at that altitude every single day year round, than even those that are living kind of in the Salt Lake Valley. So it's something definitely to be of concern. What is the difference between tanning and burning? I'm assuming all of us in the room have probably experienced both. But what's the difference?
The layering of the damage?
Okay, the layering of the actual damage. So they are both damage, right? A lot of people like to say, well, if I don't burn, right? I mean, you can see me. I'm obviously the poster child for skin cancer risk. I'm blonde, blue-eyed, pale skin, Northern European descent. I live at a high altitude, all of those things. But there's a lot of people, when they go out in the sun, they just tan their skin, right? And they say, well, I don't burn, and so I don't need to protect my skin. How many people have heard that before, right? Well, I'm here to tell you today that anytime your skin changes color, it's a sign of damage, all right? So some people, their damage shows as sunburn. Other people show their damage as darker skin. So kind of if you were to look at your butt, for example, where it probably never gets tan or any type of coloring, that's your natural color, all right? That's the natural color that you are. That's the color that we want to shoot for year round, all right? When our skin is changing really dark in the summer, it goes really light in the winter, that DNA in the cell is actually, going back and forth in terms of what's actually happening to that mutation, and we just want to make sure that we're protected year round. Tanning beds. Well, we know that tanning bed users are 75% more likely to develop melanoma. Did anyone know that there's a law in the state of Utah that if you're under the age of 19, you have to have a parental signature to enter a tanning bed every single time you go? So a lot of us probably didn't know that. So, that's the Department of Health in the Salt Lake County. They actually go to kind of check if the tanning salons are doing that. But the reason that's a law is because the evidence shows is all of the sun damage that we get below the age of 18, 19 has a risk later in life, right? So all of the damage that is occurring has the potential to give us skin cancer 20, 30 years down the road. So these are the risk factors for skin cancer. I kind of went through a few of them for myself. But I just want you guys to go through these top 11 and kind of just identify which ones you specifically have. We don't have to share, but just so that you can kind of see what our own personal risk is of developing this type of cancer. So I'll use myself as an example again. So obviously radiation exposure, that's all of us. That's exposure from the sun, potentially from the tanning bed. Blue or green or gray eyes, I burn easily. I have a family history. Several members of my family have been diagnosed with skin cancer. Fair skin, blondish, reddish hair. I had blistering sunburns as a child when I would go to Lake Powell, and we would, spend the entire week directly out in the sun and really seeing, well, I would get burned, and whose fault was that? It's no one's fault, but that's the reality more or less of not knowing and understanding protecting yourself at a young age. I live at a high altitude and I spend a lot of time outside. So me, myself, I have 9 of those risk factors, right? We could say maybe even 10. So this just is to make us self-aware of how we can actually prevent this type of disease. So there's 3 main types of skin cancer. This is just a cross-section of the skin to show the different types of cells. Melanoma is so dangerous because it's the closest to the bloodstream, the hardest to identify. So when it does spread, it spreads very fast. This squamous cell, basal cell, usually that's when you go into the doctor, they freeze it off, they'll cut it off, put a stitch in, your ear, your face, your back. Doesn't need any other follow-up treatment. Melanoma is deadly more or less because it does have the potential to spread. This is what basal and squamous cell may look like. So waxy, pearly, like a scab. A lot of our dermatologists say, if you have a sore on your body that does not heal in 30 days, get it checked out because that is, not normal and could potentially be one of these things. And what does melanoma look like? Well, this is an acronym that shows the way that we can actually conduct a self-skin exam. So just because you have a lot of moles on your body that look weird does not mean that you have melanoma. But what we like to say is there an ugly duckling? So out of all of those ones that look weird, is there one that looks different than those? In terms of asymmetry, so is it the same on the right as it is on the left? Is the border jagged or, growing in different ways? Is it changing color or is the mole more than one color? If you were to take the end of a pencil eraser and put it up against the mole, if it's larger than that or if it's growing, then all of those things may be cause for concern. So that's how we do the self-skin exam, and then we go in every year and we say, and the dermatologist asks us, is there anything on your body that looks different from the last time you were here? And if we haven't been looking at our moles, and he says, well, is there something back here on your back? It looks weird. Have you noticed anything? And you say, who knows? I haven't looked at that mole in a year. Then they may do unnecessary biopsies, right? And so we just want to be able to really understand what's going on our own skin and then helping that provider when they actually do the skin exam. So how do we prevent skin cancer? What's the best defense against skin cancer? Like behavior, like what is the best thing we can do? Stay out of the sun. Okay, so limit our sun exposure. A lot of people, when I ask that question, they say sunscreen. Well, the best is actually clothing and hats, right? You think about it, if I'm wearing a hat that's covering my face, I don't need to wear sunscreen because that skin is being completely covered. Or if I'm wearing long pants and long sleeves, then I only need to apply sunscreen to those specific areas that are exposed, right? Sunscreen, is all sunscreen created equal? What do we look for when you guys buy sunscreen? Okay, so SPF, cheapest. That's actually one of the answers that I get the most because sunscreen is expensive, right? Does anyone ever look at the expiration date on sunscreen? Okay, if you use a sunscreen that is expired, you actually may burn faster if you use that sunscreen. All right? So if you have a boat or if you have a bag where you kind of keep all of your summer stuff, don't just keep that sunscreen year after year and keep using that because one, you're not using enough and you should actually be going through several bottles every season, but also looking at that. So we recommend SPF 30 or more. That's going to block 98% of the sun's rays. You don't need to buy SPF 50. You don't need to buy SPF 100. The differences in the protection is not enough to justify kind of the price point. So SPF 30 is kind of the best sunscreen. Looking for things like broad spectrum. Mineral-based sunscreens are a lot better than the chemical ones. If it has zinc in it, it's going to be the best sunscreen that you can buy. So we say there's no such thing as a healthy tan, because as we get older, that skin not only sags, but it also just starts aging with age spots, as well as increasing your risk of developing the disease. So we're going to end on a couple things. I have some cards that we'll distribute that have all of this information on it. But I did just want to touch base about the vaccine piece, okay? Because we want to touch and really explain what the vaccines that are available to help prevent cancer as well. So those vaccines are two things. The HPV vaccine. Has everyone heard of the HPV vaccine? Okay, there was a lot of media last month in the state surrounding HPV vaccination because it was Cervical Cancer Awareness Month. But HPV infection, it's the most common sexually transmitted disease. All of us, most of us, I would say 85 to 90% of us will get HPV at some point in our life. It's spread through skin-to-skin contact. It's spread, through bodily fluids, sexual contact. But a lot of us say, well, I don't need to get the vaccine because I'm only going to have one partner, or I'm not going to engage in those behaviors because, I'm just not promiscuous, or I may not just need to get that vaccine for my children because they're going to abstain from any of these behaviors that could potentially cause this HPV vaccine. Well, what we know is this the HPV virus is causing the majority of cervical cancers. It's causing head and neck cancer, as well as many others as well. And so who should be getting vaccinated? Well, boys and girls from the age of 9 to 26 should be getting vaccinated. So why do you think it's actually so young, right? Why would they recommend to be vaccinated at the age of 9, 10, 11? Okay, before puberty. Your immune system is actually the strongest in that time, and so the vaccine is going to actually work better in your system. It's also before you may be exposed, to the virus in any capacity, as you get older. And so if you do get the vaccine, you should be getting it as a 2-dose series, starting at the age of 11 and 12. Now, Utah has we're number 49 for girls and number 41 for boys in terms of getting the vaccine across the country. So there's a lot of work to do that needs to happen to make sure that we are actually increasing our vaccination rates. Now, are there any questions related to HPV? Yeah.
You didn't address why
Okay.
it wouldn't work for somebody.
Okay, so let's say you're 30 years old and you go in to get a pap test and the HPV test. They're going to try to detect if the HPV infection is present. The general recommendations don't extend past the age of 26, but that may be something that you can talk with your doctor about and say they may give you the vaccine kind of on a case-by-case basis if you don't fall into this specific category. This is also covered by insurance. If your pediatrician has not talked to you, if you are a parent, about getting the HPV vaccine, that's a lot of the work that we're actually doing at Huntsman, is really trying to get the word out to those primary care providers and physicians. The other vaccine is the Hep B vaccine. This is actually a cancer prevention vaccine for liver cancer. And so that usually starts, as an infant, but it's either a 3 or a 4-dose series over a 6-month period. This is not controversial. This is very controversial only because it has to do with sexual behavior. But if we were to get everyone vaccinated with the HPV vaccine, we could prevent up to 40,000 cancer cases every year in the United States. So with that being said, that's kind of the vaccine piece of all of this with cancer prevention, as well as everything else. And I know I went over, but we do have a few minutes for questions. I know it's a lot of information, but hopefully you learned something today. What questions do we have? None? That might be a first if we don't have any questions.